Welcome to the Body Shop Physical Therapy. I'm Dr. Catherine Price, and I'm a physical therapist. I have 15 years of clinical experience, and one of my missions is to help folks who are in chronic pain. And over the years, I have noticed patterns and I have collected information, and what I have found is there is an approach that can help restore the joint movement and health. So what I want to talk about today is the Arthrokinematic Restoration System. This is a systematic approach to address osteoarthritis in the body, and it's an approach that I developed and would like to bring more attention to in order to help folks who want to avoid a joint replacement or either get out of chronic joint pain. So osteoarthritis is the wear and tear of the joint, and it's the cartilage breakdown over time. It was used to thought that once you lose your cartilage, you're not going to get it back. So the cartilage gone is cartilage gone. The youth can regenerate some cartilage if it's been damaged, but in older populations, it's been thought that you cannot encourage or have cartilage production come back. And this is something to think about, and there's a lot of research going into trying to understand more about regeneration of cartilage and what to do about osteoarthritic changes as we age and get older. And the reality is, yes, the wear and tear, and as we age, the protein synthesis is markedly less. So once you have breakdown, it is much more difficult to replace and to heal. So if you are older, you may notice that it is a longer healing time when something is injured. There is great research in going into finding out how to better stimulate the chondrocytes, which are the cells that produce the collagen, which makes up most of the cartilage in the joint. A lot of research is going into finding how to manage symptoms of arthritis, and this can be through drugs, through surgery. To date, there is no clinical physical application to addressing osteoarthritis other than research done just with general exercise. So what the Arthrokinematic Restoration System is, it's a specific approach to address the biomechanics in the joint. It addresses joint mechanics. And my philosophy is, if you fix the glide, you fix the pain. There is a roll and there's a glide in the joint. And the glide is where most of the friction is. If you can reduce the friction, you can restore the movement in your joint and then give your body the opportunity to then do its job to heal. There's a lot of misconceptions, and also what I do see is that people that do end up having joint replacements, sometimes there is still pain afterwards, even 2 years later. And there is no pain receptor in your in-bone cartilage. Yes, the meniscus, that disc cushion, I don't want to have mistaken information about the pain receptors, because there are pain receptors in your meniscus or the disc that a lot of folks think of in the knee. But the in-bone cartilage, that's the cushion at the end of the bones. There are no pain receptors there. So when you're having pain in your joints, it is coming from the muscle tendon unit, the ligament, the bone, and the skin or the capsule. So you are not getting your pain from the cartilage, but that is where the breakdown happens, and the cartilage is there to help cushion so that you do not have any of the effects of disruption on the other parts of the joint. So the cartilage is protective, but that's not where the problem is. The problem is in the mechanics. You can be born with mechanical problems. You can acquire mechanical problems through repetitive movements. This is something that occurs over time. Osteoarthritis is attritional. It occurs over time. Nutrition plays a role in it. So the restoration of the joint is going to also be reliant on your nutrition. And the combination of getting the mechanics right and getting the nutrients in there that the body needs can have great results with restoring joint mechanics and movement and the reduction of pain. So if you're looking for a way to help avoid a joint replacement, or you're in chronic joint pain, then the Arthrokinematic Restoration System may be something to try. It's a conservative approach, so it's no invasive procedure is involved here. There's no surgery, there's no drugs. It's just you doing the right things to give input into your body to help it to restore back to its optimal state, which is where we want to be. So I really enjoy seeing people out moving and having a good time and enjoying the freedom of their bodies moving. And to do that, it is most easily or more, in order to do that, you want to be in a pain-free state. Pain is not to be feared. It's a communicator. It's telling you, hey, there's something going on. Pay attention to me. And what the Arthrokinematic Restoration System does is it is going to use that pain as a communicator. It's going to help determine what needs to be addressed biomechanically in the joint. And working with a therapist, you can possibly restore your joint health to the point that you can return to the activities that you enjoy and do them pain-free. And that's the goal, is to be able to enjoy your life and enjoy moving. What I would like to do is be able to teach other physical therapists this approach in order to help their patients. So if you are a physical therapist and you're interested in learning the Arthrokinematic Restoration System, please don't hesitate to reach out through the email on this YouTube account, and I will respond. If you want to do an in-person course, please let me know. If you would like to take the online course, also let me know. The North Carolina Board of Physical Therapy Examiners has approved my 3-credit-hour online arthrokinematic restoration course, and so that is a possibility. And this is just skimming the surface. There is a lot to think about when you are restoring the biomechanics, and everybody is different. There is a creative approach as well, because people can get in different positions. Some can get in positions that others cannot. So using your creativity, understanding the mechanics, and being able to use this system to help your patients can be life-changing. So if this is something you're interested in, please reach out. If this has been helpful, please like, share, and subscribe. I really enjoy getting information out that helps improve the quality of people's lives. And have a blessed day. Thank you.